in on what's going on. So at this time, again, I'm Jamar Barnes. I'll be your moderator for the evening. If you have any questions, comments, or concerns, continue to lift those up throughout the chat all evening long. Again, I'm Jamar Barnes with Good Reason Houston, the lead of family and community engagement. Welcome to our VAXX Talk conversation with some of Houston's leading experts in the community. At this time, I'm going to do a quick whip around and introduce all of our panelists and let them speak for themselves. So I'm going to start with Dr. Victor Narcisse. Would you introduce yourself and let us know where you're working at, and just say hello to the folks.
Good evening. My name is Dr. Victor Narcisse. I'm the Associate Division Head of Hospital Medicine at the Houston Methodist Hospital for the Hospital Physician Organization Group. I am a proud member of Alpha Eta Lambda chapter here in Houston, Texas, of Alpha Phi Alpha, and a Spring 90 initiate from Rho Iota chapter.
Awesome. Thank you, brother. We also want to bring forward Dr. Gerina White, if you'd introduce yourself to the folks.
Good evening. I'm Dr. Gerina White with Harris County Public Health, an internist and pediatrician by training. I serve as medical director in one of our divisions, and as well during this COVID operations and the pandemic, I'm an alternate local health authority and medical advisor.
Awesome. Thank you. And we also want to bring forward Stacey Lofton.
Good evening, everyone. I'm Stacey Lofton with Harris County Public Health. I lead equity initiatives for the department and along with numerous partners throughout Harris County.
Awesome. Thank you, Stacey. And last but certainly not least, Brother Kyle Maroney.
Hello, everybody. My name is Kyle Maroney. I'm a member of the Epsilon Tau Lambda chapter of Alpha Phi Alpha Fraternity Incorporated. I also work with Harris County Public Health as a community resilience specialist. Pleasure to be with everybody tonight. Thank you.
Awesome. Brother Maroney will also be speaking this evening on behalf of the Epsilon Tau Lambda chapter of Alpha Phi Alpha Fraternity Incorporated. Before we get started, I want to give a huge shout out to the team and the staff at Good Reason Houston, where we believe that every single child deserves access to quality schools, no matter who they are, where they are, and what neighborhood they live in. This evening, we've got two amazing gift card raffles that are sponsored by the good folks at Good Reason Houston. We want to go ahead and jump off this evening, and we're going to give away our first raffle. We've got a door prize for our very first Zoom participant who logged in first tonight. And so we'd like to give that gift away to Brother Jarek Brown, the president of the Epsilon Tau Lambda chapter of Alpha Phi Alpha Fraternity Incorporated. So there are $25 in gift cards coming your way via email this evening. So we thank you so very much for that. And for those of you who are here, again, welcome to our VAXX Talk conversation. We've got some amazing panelists. This evening, we're gonna go on ahead and turn the floor over in just a second. We're gonna introduce our keynote speaker. Then after our keynote speaker speaks, we're gonna have some time and opportunity for each panelist to give their scope and perspective from their organization's lens. And then after that, we're gonna jump into some question and answer. And then we're gonna give another gift card raffle away. So we want everyone to stick around for that. And then we'll have our partners close out and letting you know what's up next in the pike for their organizations and things that you can expect from them. So without further ado, I want to go on ahead and introduce Brother Dr. Narcisse Victor Narcisse. Victor Narcisse is our keynote speaker for the evening. Brother Narcisse worked at Houston Methodist Hospital as, again, the Associate Division Head and part of Houston Methodist Physicians Organization Hospitals Group. Dr. Narcisse is a board certified person in internal medicine and geriatric medicine. He is a fellow of American College of Physicians. He is also a fellow of the Society of Hospital Medicine. He is a member of the Alpha Eta Lambda chapter of Alpha Phi Alpha Fraternity Incorporated and a spring 1990 initiate of the Rho Iota chapter. At this time, we want to bring Brother Dr. Victor Narcisse to the front. Welcome, brother.
Good evening. Thanks for thanks for the warm introduction. I'm here to talk a little bit about COVID and why I think that it's important to get vaccinated. I think that we'll go to the next slide. If you start to look at the numbers of individuals in our community who've been affected more than 400,000 have been affected at some level, with thousands of individuals in our community who have died. Around the country, that's more than 500,000 people who've died. And while this seems to come in waves, and we've had here in Houston and around the country spikes where things have been better and things have been worse, this remains an ongoing problem in our community. And next slide. What we actually see is that the risk is not the same across all communities. If you look on the left, you'll see that the curves seem to be fairly similar in terms of the number of people who become affected by COVID-19. But on the right, you can see, and again, it was most apparent in the earliest phases, but remains that there seems to be a different risk for different communities. And it's one of the reasons why I became so passionate about this concern, because a lot of the people who had a lot of illness and died of this are people who looked like me and came from my community. Next slide. Yeah, and so we've developed some approaches to try to address what has happened. And I wanted to kind of give you some basic ideas, and we'll go into more depth and detail about these. People have said, well, gosh, the vaccine has not been well tested. It actually has. It has been tested in a variety of groups, including groups that look like myself. And if you take the COVID vaccine, you will become protected against severe symptomatic infections. Additionally, it also will protect others in your community, others in my community, from getting ill. And the vaccine is indeed free to you. I think there's a lot of misconceptions. We'll talk more about them as the evening goes along, but people have said it's got preservatives, it has pork, it has live virus, it's going to get me sick. All these things are untrue. We'll talk a little bit about them as we go along. Next slide. These are the covers, the cover pages of the New England Journal of Medicine for the release of the studies for each one of these. This is the most prestigious journal in all of internal medicine, and it really showed with all these little curves, all these diagrams, a very unique opportunity, something that has not been available in the past, but is highly effective, highly effective. So we'll go to the next page. And what we'll talk about is the three kinds of vaccines that are most commonly available in the United States. There are some things over the horizon that may be available in the very, very, very near future. But currently we have the Pfizer vaccine. This is the one that I've taken. My family members, including my 13-year-old, has had an opportunity to take the Moderna vaccine, the Johnson & Johnson vaccine, otherwise known as Janssen. They're a little different. The first two, Pfizer and Moderna, use a new type of technology called mRNA. And this is a very, very, very exciting. People have wondered in my community, gosh, if it's new, has it been well tested? How is it possible that a vaccine was developed within such a short period of time? And the reality is that while the vaccine was uniquely designed and developed for coronavirus and the COVID-19 illness, they were actually developed over decades of research that go all the way back to the SARS and MERS outbreaks that happened in Asia and Southeast Asia more than a decade ago. So what I often will tell people is the car was built, the car was gassed up, and with new information when the COVID virus was identified, we downloaded the GPS into the virus vaccine, and we were off to the races. Both the Pfizer and Moderna do require 2 shots, and they're highly effective against both symptomatic individuals when they were studied in trials. The numbers you see here on the screen are the numbers that were actually developed in the summation of the trials that were used to approve the drugs, the vaccines in the United States. And then to the right, our real world experience. So 94, 95, 90%, 100%, these are numbers that we don't get from most of medicine. When I give somebody an antibiotic, I don't get 90% activity in many cases. And so this is really exciting level work. Even the newer one, the Johnson & Johnson, which uses a different technology, an older technology, using adenovirus, has been inactivated. So they kind of take a cold and flu kind of a virus, put the GPS into that virus, and then introduce that to the patients. And again, while this is a one-shot vaccine, which is extremely exciting particularly for those who have trouble coming back, those that we've had trouble talking in the first place, perhaps, and it doesn't seem to work quite as well. It still works very, very nicely. And again, if that was the only one we had, we would be overjoyed. Next slide. We've actually studied this here at the Houston Methodist, and we've looked at more than 91,000 individuals in our patient pool. And what we found is that many people have not yet been vaccinated, and as a result been hospitalized. And we've had, unfortunately, a number of individuals who've died. But if you could look at the individuals who've gotten the Pfizer vaccine, the one dose, and again, fully vaccinated with the second dose, very effective in terms of prevention of disease and extraordinarily effective at preventing deaths. Next slide. Some people have argued, gosh, Dr. Narcisse, I had COVID during the fall, during the winter. I don't need to take this vaccine. And so what we've actually done is, throughout the medical literature, looked at individuals who are who've had the virus, who've not had the virus. In this case, this was a study of healthcare workers. In the study on the right in England, we looked at very, very large studies. And we can go into as many of these details as you like, but the take-home message was that, yes, individuals who've had COVID have had antibodies, but they might have even had relatively high levels of the virus, and as a result could reinfect other individuals. And that was one of the things that we were very, very interested in understanding, as well as how long does the native, I got the infection just in the community, how long will that protection last? And those are questions that are still being answered, but right now it looks like the vaccine is superior. Next slide. Again, if you look at those individuals who've not yet been vaccinated, if you look at those who've been infected, about 92% out of 1,000 chance of getting infected, whereas the vaccinated individuals, 0.97% of those individuals per 1,000 in our community had infections. And again, many of those infections were asymptomatic. If you look at the hospitalizations, the reduction in hospitalizations from the unvaccinated to the vaccinated, 2 orders of magnitude, more than 100%, 100-fold. The deaths, again, 100-fold protection against death. And so if you were in any other walk of life, if you're doing anything else, and you said, hey, look, there's 100, I can reduce your chances of dying 100 times, you would take that. And I'm not even going to talk about what you would do in Vegas at our casino. Next slide. Again, when we looked at the Pfizer vaccine, individuals at 6 months, it looks like the vaccine was very effective against the symptomatic ones, against severe infections, 95% effective, against, in another study, 100%, and 100% effective at preventing death from COVID-19. So this is, again, very, very exciting. And again, over a 6-month period of time, the vaccine seems to be very durable. Next slide. But one of the things I'd like to talk about is that those individuals in the community still have a significant risk of infections. If you look at the graph on the left or the graph on the right, you can compare the risk today. Again, everyone feels like, wow, the community is open. I can go on vacation. I can do whatever it is I wanted to do. I don't need to do any social distancing. I don't need to wear that mask. I don't need to take the vaccine. Well, right now, the risk today is similar to the risk we had months ago in March or in April, when things were much less certain and much more worrisome. And one of the things that's happened over the horizon is that there's a recognition of new variants of the virus that, if allowed to continue to spread in our community, will become a bigger part of what we're seeing. And those viruses may not be as our current vaccines may not be as effective against those virus variants. Well, a lot of people worry about the side effects. Well, this is what the Pfizer vaccine looked like. Again, the adverse effects that we see on the left are the kinds of things that we often will see when individuals feel like they're getting the flu. I'm sorry, next slide. And one more. Sorry. There you go. The side effects that you're seeing are essentially the same kinds of things that you see when you're having the cold or the flu. Fevers, fatigue, chills, feeling bad, kind of aches and pains in your joints. Well, again, if you've had the vaccine, you're more likely to have these kinds of things because your body is looking at the virus. Even though your body's making the parts that are going to attack the virus, it still looks at it as somewhat of a foreign invader. So yes, there are side effects, but if you go to the next slide, there are things that we can do to reduce those side effects. I think that it's very simple to use very simple over-the-counter kinds of things, over-the-counter kind of medicines that are very, very common sense, from washcloths to avoiding exertion, drinking lots of fluids, dressing lightly. Again, more people have side effects with the second shot than with the first, but again, we often say it's the sign that it's working. Next slide. People worry, gosh, I'm going to have a serious side effect. Well, if you look at the vaccine group versus placebo group, is essentially identical. There have been very, very few people who've had serious events with this. And while it is true that it sometimes happens, we have not had anybody die from those as far as I know. Next slide. And again, the severe allergic reactions are very, very uncommon, but that's the reason why we have individuals wait for about 10 or 15 minutes under observation before you go after your COVID vaccine. Again, some people have had to be treated with antihistamines. Those are relatively easy to do, very, very safe. Nobody's died. So thousands upon hundreds of thousands of people in the United States have died. Nobody's died from the vaccine. Next slide. So the risk, if you live in the United States, of getting COVID is still around 4%. The long-term complications, we still see individuals coming to our clinics with long-term lung, all sorts of unusual complications of COVID. In fact, we're doing lots of study to try to understand the unusual things that have happened with individuals who've had COVID. But about 1 in 100% chance of getting hospitalized, about 1 in 1,000 chance of dying. The vaccine, about a 50% chance of getting a mild or moderate reaction, the anaphylaxis that's so dangerous, about 1 in 100,000. Other side effects, people have talked about some immune things, blood clotting, other blood disorders, about 1 in a million. And again, no deaths from the vaccine. Next. The problem we have right now is that around the country, we just haven't gotten enough people vaccinated. 141 million people have been fully vaccinated, but we're still struggling in most communities and to try to get everybody fully vaccinated. Next slide. And unfortunately, you guessed it, it's my community that has one of the most difficult times getting the access to the vaccine. The vaccine saves lives, but people in my community who are the ones who are dying, especially early on in the crisis, they're the ones who have a limited access. And that's one of the things that we're hoping to do. And if you look at the slides on the left and the right, you can see the African-American groups on both sides are woefully small amounts of vaccination. And while lots of people were, if we go to the next slide, you can see that when the vaccine first came out, there are lots of people were excited about it. And now as the summer has gone along, people are on vacation, people feel like, I don't need to get it. I didn't die yet. Maybe I still won't. So I won't need to bother. I think that's a mistake. We'll go to the next slide. In Texas, you can see that about 46% of individuals have gotten some vaccination, about 38% fully vaccinated. In Harris and Waller County, you can see that those numbers, again, 38%, 27%, these are problems. And to get to herd immunity, everyone's heard about that term. Herd immunity is when enough people are vaccinated in the community that we think that it's very difficult to spread the vaccine from one person to the next, because the person you would give it to has already been vaccinated and can't send it on. So it's kind of like playing that telephone game when we were a kid, and you give the message to the next person and they just stop. And that's what herd immunity is like. And if we don't get to herd immunity, the vaccination with vaccinations, then more mutations will develop, and those mutations potentially could defeat our vaccination strategies. We'll go to the next. Here, this is one of the Indian reservations, one of the Indian nations in Montana. They were able to get 98% of their community vaccinated because they put a lot of effort and energy into it. So it can be done. And they have a lot of the same concerns that we do: disparities around health access, lack of infrastructure, distrust of the federal government. And their campaign was prevent the spread on the Reds. Got to like that name. They went door to door, mobile vaccinations. We might need to do the same, but it starts with you. The next slide. I just wanted to mention briefly, there was a vaccine mandate. So if you work at the place where I work, then you have to get fully vaccinated if you want to keep your job. Some people were unhappy about that. Some people took that to state court, that went to federal court. You may have heard over the last day or so, those lawsuits have been dismissed. So if you come to see a physician or a clinician at Houston Methodist or any of the Methodist facilities, they've all been fully vaccinated. Otherwise, they would have lost their job. So next page. So who's eligible? Who can get the vaccine? Everybody in Texas over 12. Everyone in Texas over 12. There were times when we restricted it. We went through that timeline very, very briefly. I can talk about it later if people have a need. But right now, what you need to know is it's important to get the vaccine. It's safe. It's the right thing to do for yourself and for your community. Where can you get it? The first one I wanted to mention is Church Without Walls is having an event this week. And that's a fabulous access. If you are unable to attend there and still are interested, Houston Methodist, CHI St. Luke's, Harris County, Memorial Hermann, UT Health, all are vaccination hubs. And I'll stop there and take any other questions you might have towards the end.
Awesome. Thank you, Brother Dr. Narcisse. What we want to do at this time, one, you've given us a lot of great, healthy information, especially from that academic side, from the medical standpoint. What we want to do at this time, we're going to bring our panelists to the forefront. Also, we want to make sure that, again, for all those of you who are here tuning in, make sure that throughout the evening, you're dropping your questions in the chat. We want to make sure that we get those questions answered for you. We do have some prizes on behalf of not just Good Reason Houston, but the amazing folks at Harris County Public Health. And we're going to bring our panelists to the front at this time. We're going to talk to Dr. Gerina White. We're going to talk to Stacey Lofton. We're going to talk to Pastor Raphael West. We're going to talk to Kyle Maroney and myself, Jamar Barnes. And I want to start with Stacey Lofton. The whole aim of this evening is for us to talk about why vaccine hesitancy is a thing and why vaccine awareness and things like that are important from the angles of each organization. And so from the Harris County Public Health lens, why are the vaccines really important, and what information do you all have for us?
So thank you for that question, Jamar. So vaccines are important because we really are working to make sure that all residents within Harris County have a fair opportunity to be healthy and to thrive. And we know that COVID-19, like a number of other diseases, as Dr. Narcisse described, disproportionately impacted our communities, right? Our Black and Brown communities. And we know the most effective way to intervene is through vaccinations. And so that's why we really are pushing vaccine events throughout Harris County and making sure that we focus on those communities that have been disproportionately impacted throughout Harris County by COVID-19.
Awesome. Thank you. Thank you. I want to bring Dr. Gerina White to the front as well. Dr. White, would you again share from your perspective, especially with Harris County Public Health and your lens about the vaccination awareness and just why that's important from the scope of your work?
Thank you. Let me make sure you can hear me. Good, thank you. So I just wanted to also share an update on behalf of the county, just so the listeners on the call understand that when we look at our county numbers, when we look at the city of Houston and combine it as well with Harris County, we've had confirmed almost 400,000 cases, and we currently still have about 4,000 active cases. So to Dr. Narcisse's discussion, you know, it's not to be taken lightly that we've had almost 5,000 deaths. And disproportionately, like Stacy mentioned, it's in those in vulnerable communities that we know we serve on behalf of the county. So one of the things that we wanted to really recognize is how to best get to the sort of that granular ground level, similar to what he mentioned with regards to the Indian community in Dr. Narcisse's presentation. We actually have leveraged having COVID vaccine operations. And what we've done, it's not just unique to us, but we're very proud that we have vaccine dispensing units. And those units are tailored to really get out to the communities. We're partnering with organizations that really have those relationships in the communities and have a trusted sense that we're here to ensure that we can get out, sort of that door-to-door model. We also have community vaccine units, and those are able to sort of put up pop-ups. And so those also are really saying, okay, how can we get out to the community and really get vaccine into arms? We were also partnering with FEMA, and we have a much larger scale site at the NRG operationally. And so that is going to be continuing at least for another month, but we absolutely saw tremendous value in our partnerships to do those smaller, intimate opportunities with what we call our VDUs. So that's been very insightful to get vaccine into arms. And then, like Dr. Narcisse mentioned, the candidates who are 12 and older, who are able to be vaccinated, fully vaccinated, we're still only at 46% of our 12 and up. And if you look at who's at least gotten an initial dose, we're still only at 57%. So we have some room for improvement. And we wanted your listeners to make sure that they understood that if they had any questions on how to partner with us to, again, get more vaccines in the arms at that ground level, we'll be sure to give you the phone number or the email where they can reach out to us.
Awesome. And just before we transition to Ralph West II, we want to just be clear again that you all are, Dr. White, correct, willing to work with organizations to have vaccination drives around the city, correct?
Absolutely. We're definitely interested. So definitely please reach out to us. And I actually wanted to give one more sort of update that we've also partnered. The county has a scholarship program right now. It's called the HCPH Vaccine Scholarship. any resident under the age of 18 who has been previously vaccinated or gets a vaccine will be registered for the scholarship. And we've actually had our first winner, Jose Meja. He's at Elsick High School. So he will get a $5,000 scholarship to the college, trade school, vocational, or any university in the state of Texas of their choosing. And we're just excited. We'll be doing that for the next 9 weeks for our young people.
Awesome, awesome. And at the conclusion of the evening, we'll have all these amazing presenters. We'll get them to drop their information and ways that you can contact them as well. Brother Ralph West II, we want to thank you and your church for all the participation that you guys and the steam that you're helping us to put behind this entire week as far as our vaccination awareness. With you being a faith leader and centered in one of North Houston's largest, most impactful churches and faith ministries, why is it important for the parishioners at your church to either be vaccinated or aware of what's going on with COVID?
Well, it's first important. First, I want to say thank you so much for having me and us as the Church Without Walls a part of this panel discussion. Thank you so much. But a two-part question. One, is important for the parishioners to be informed, is because that's part of our vocation, to be aware of what's going on in our community, both locally and also nationally. And the more that you're informed, the more you're able to operate in the necessary avenue and vein. And as parishioners and leaders, the number one rule in leadership is you have to live it out. You know, in Luke 11, the only time the question was asked of Jesus, teach us how to pray, it was about 7 times Jesus prayed from chapter 1 to 10 that his disciples saw him pray. And finally in 11, they asked him, teach us how to pray. They saw him do it so much because they followed him. They finally asked him, how do we do what we always see you do? So it's important first for the parishioners, the leaders, to model this out, to be informed, to also vaccinate themselves. And because the people that listen to us and follow us will likely model and do what we do. And it's even more important, as I was preparing for the discussion today, you keep in mind, whenever you see in the medical field, the stick with the snake on it, you know, a lot of people think it's from the Greek mythology, the son of Apollo, Asclepius, who is the son of Apollo, the god of healing, when it actually came from Numbers chapter 21. The children of Israel were grumbling against God and Moses, and God sent down fiery serpents. Then after they were bitten, then God said, now Moses, take the serpent, put it on the stick, and tell everybody to look up to the serpent. And so, unfortunately, many people have just had so much distrust, not just in the medical field, but also in the history of America when it came to healing and medicine. When it's right there before us, we have access, opportunity, and availability. And we have a duty to our community to let our people know, not just in our congregation, in our community, we have opportunity, access, and availability. We have medicine available to us to get us closer to the goal of being whole again.
Awesome. Thank you for that. That was really powerful. I know that you definitely not only ministered, but poured out something great there. Thank you so much, Brother West. We appreciate that. We want to shift the conversation to Brother Kyle Maroney, who will be speaking on behalf of the Epsilon Tau Lambda chapter of Alpha Phi Alpha Fraternity Incorporated. Brother, we know that the Epsilon Tau Lambda lately and in years previous have been leading the way, as well as the entire fraternity in service. And so on behalf of Alpha Phi Alpha, why is it important, Brother Maroney, either for the members of the fraternity to be vaccinated or aware, or even those in the communities that the fraternity serves? Why is that important?
I think for us, as I continue to listen to this wonderful speaker and to try to follow Reverend West II, I think it's important to not only be an organization that says we're about leadership, that says we're about service, that says we're about brotherhood and sisterhood, that we act those out. I believe, especially for our young brothers who might not feel as if they feel that they are threatened by COVID-19, it's still very, very important that they take the lead and take the charge in getting vaccinated, because as we try best to get back to normalcy, we're going to be interacting with our older brothers and our older sorority sisters might be vulnerable to COVID-19. So we want to make sure that if we want to fully get back to the brotherhood and the sisterhood we had before COVID-19, that we take our leadership role seriously, we take our commitment to service seriously, that we do not take this juncture of the COVID-19 pandemic for granted. I don't know about anybody else, but I know that I'm tired of doing Zoom brotherhoods. I'm tired of doing Zoom happy hours. So I think that we have to take that responsibility seriously. Houston never closed, technically. Everyone feels like Houston never closed. Houston stayed open. But as we're at this juncture where everything is officially open per the governor's order, we have to not take COVID-19 for granted. And with that, I'm going to pivot back to you, but I just wanted to share that charge to fraternity brothers and sisters to be leaders, not only in word, but in their deed. So thank you.
Thank you, Brother Maroney. I want to talk on behalf of Good Reason Houston. For those of you who, again, are not aware who we are, just kind of getting hip to who we are one of the most amazing nonprofit organizations here in Houston, Texas, and we are serving not just the school districts, but the communities as well. And one of the greatest things that we have seen as leaders and as those who are connecting the dots in Houston, one, we believe that all children should have access to high quality schools, no matter who they are, what neighborhood they live in, that their teachers should be excited about learning, that they should be excited about learning, their parents should be advocates. However, COVID has kind of, in all of our lives, come in and kind of put the brakes or some halts or thrown some loopholes in all of our action plans. And so with COVID-19, we have seen a large learning gap. We've seen an increased academic deficit. And from our lens, it's really important that not just our teachers be vaccinated so they can safely be interacting with our students and close that gap. Our parents are vaccinated so they can be safely interacting with their children at home, closing that gap, helping with homework. Our administrators, and now those students who are eligible age-wise and health-wise for the vaccine, as often as possible, become vaccinated, fully vaccinated, because what we want to see is those learning gaps close. What we want to see are our future doctors, our future reverends, our future pastors, our future Stacys and our future Kyles and Victors and Ralphs and Jamars. We want to see those children in those schools learning, getting what they need, because to echo the sentiments of Kyle, I think that a lot of people have gotten Zoom fatigue. We've seen a lot of parents struggling with helping their kids with math via Zoom. We've seen a lot of teachers struggling reaching their children. We know that learners learn best when they are in school. We know that a lot of learners learn best when they have that tactile, tangible learning in front of them. And so what's really important is we want to make sure that our children are vaccinated, that our schools and our leaders and everyone, that they are aware. And so the information that not only Dr. Narcisse, but even Dr. White provided are also tools that we can all use, because education is not just for children, but it's ongoing for adults like ourselves. So from the Good Reason Houston perspective, it's really important for us to get those vaccinations accomplished or make that education available so we can close those learning gaps in our schools across Houston. At this time, the part of the evening that I think we've all kind of been waiting on, we've got a lot of questions that have been coming in, so we are so excited for the engagement. We've got questions for just about every panelist from every spectrum. At this time, if you have any questions, we want you to either drop them in the chat or hit that question and answer button and put your questions in here. And I will be moderating and fielding our questions for the next 5 to 8 minutes. So we want to let you know if your question doesn't get answered or asked, please don't charge it to our heads, only charge it to the time. But the first question that we have is for Dr. Narcisse. If I do not get the flu shot and have historically not gotten the flu, is there any issue with having the belief that I will be able to avoid the vaccine? So I'll read that question again. If I do not get the flu shot and have historically not gotten the flu, is there any issue with having the belief that I will be able to avoid the vaccine? Oh, okay, you got to unmute. Okay.
Good?
Yes.
Yeah. All right. This is a simple one. It's true that you may have not gotten a flu vaccine and not felt that you got the flu, but here the chances, the risk is so high of getting into big trouble. Again, we said over the past year, about 1 in 100 people in our community got hospitalized. 1 in 1,000 died. Having almost 4,000, 5,000 people in the Houston, Harris County area dying is like filling up a football stadium that I would play in when I was in high school. That's just a tremendous loss to our community, and the risk of getting the vaccine is actually so small. So the real question is, what are you willing to risk, and what are you hoping to gain? And so if you say, look, I'm not really ready to die, and I could do something that would increase your chances of living by not just double, but 100-fold. I can give you something that would increase your chances of living by 100-fold. Would you be interested? And the answer, I think, here says that it would be compelling for many, many people. I don't walk in the shoes of everybody else. I can only tell you my experience. In my experience, I spent more than 6, almost 9 months living away from my family when I was working above our garage, because I was afraid of giving them my family members, getting them sick and causing them to die. I actually signed. I did my will. I signed it. I did end of life planning. I sat down and I talked to all the people who were close to me and told them all the things that I was hoping that I would never have to tell them, but the things that I wanted them to know before I would die. That's how seriously we took all of this. And it's because we saw our friends and our family members get sick. And, we saw in my ICUs, it wasn't a Houston Methodist physician, came from another organization, but we saw physicians die. We saw nurses die, respiratory therapists die. So we also saw grandmothers, grandfathers, fathers, brothers, uncles, sisters, sons, daughters. And so again, when all that's happened, if I could make it 100-fold more likely that you will live, is that something you'd be interested in?
Awesome. Dr. Narcisse, before we transition to Raphael West, because there's a question for Raphael West. Another question that has just come through for you, Dr. Narcisse. How long does each of the vaccines last?
So again, the studies are still ongoing, but so far, even at the 6-month period of time, there's really good evidence that there's good benefit at that time. People have wondered, do I need to get a booster like I do every year with the flu? That's possible. We may get to the place where that's necessary. But right now, the current vaccines are effective against what we're seeing currently, our current risks. And so we believe our strategy is going to be a durable fix. But that also depends on getting many people in the community vaccinated, so we can reach that herd immunity, so that it becomes so difficult to pass a dangerous new strain of the vaccine of the virus from one person to the next.
Awesome. Thank you, Dr. Narcisse. Our next question actually is here for Ralph West. So Ralph, Brother West, the question that just came in for you is, your church has been a pillar in the Houston community for so many years. What are the activities and services looking like at your church now, while we're in COVID and now that the vaccine is out?
Now we're still moving cautiously. We see the finish line, but we're not claiming that the race is over yet. We're moving week by week, and cautiously, as I said before. Right now, we're putting together a 3-month plan for June, July, August, September. Each month, we're slowly bringing back certain leadership into corporate worship. and doing about 2 or 3 leadership groups at a time. First, getting them back acclimated to being in the building with each other. Then also restructuring our system as far as our seating plan and chart. It's been fun the past 2 weeks watching everyone scramble because they're just not used to the process and procedure that we have as far as checking in into service, registering, getting the service, and then sitting with gaps in between us. But because we've been so excited to see each other, everybody wants to be next to each other, and like, hey, we can't break the codes. I know we're back in corporate worship, but kind of. And we're starting off with our leadership because the leaders are influencers, and we want to influence the rest of the congregation by sending out the message. Listen, we see the finish line, but the race isn't over with yet. So right now we're starting with our leaders in corporate worship. We're also with our staff members. Instead of them being in their normal staff areas, we're spreading them out in our different classroom areas. Even me, I'm in a corner by myself, away from everybody. So we're moving step by step. We're excited. We're anticipating the return, but because we're one church, 3 locations, we're moving methodically on all 3 campuses. And we're starting with the leadership, just a handful at a time, strategically moving back into the flow of corporate worship together.
Awesome. That's awesome. That's coming from the top down. Awesome. Our next question is for you, Dr. White. The question that was brought up is, what assurances can be given to prevent Black community members from passing on the opportunity, especially if the vaccine is readily available? So again, what assurances can be given to prevent Black community members from passing on the opportunity, especially if the vaccine is readily available?
I like that question. Thank you for the question. I think forums like this that bring together trusted sources that serve a relationship in those communities make that happen. And so getting your information from a partner, from someone, your pastor, your daycare setting, right? Like schools are in the communities and they trust that principal, trust the teacher, trust the pastor. All these like local level trusted resources, I think will be what's needed to help build that relationship and help more of us brown and Black communities get vaccinated. And on behalf of Harris County Public Health, really that unique opportunity to do those vaccine dispensing units, working collaboratively with local agencies and local organizations, and we're here to be that resource, will also help.
Awesome. Another question that just came in for you, Dr. White, is in reference to promoting vaccines in Houston, which age groups should mostly be emphasized and maybe why?
So we really, at the very beginning, like Dr. Narcisse mentioned too, we really did a strong effort at the very beginning of the pandemic, and we were looking at the populations, the 80 and congregate settings, and we spent a lot of time with the 80s and older, 70 and older, and 60. And as we learned more information and got more information, more studies were done, and the EUA came out that we could do younger populations. We're really now looking at sort of that 40 and under and really targeting those populations to really get vaccinated. And I like what someone said earlier, letting the community know like your personal story. So I'm vaccinated, and making sure the people around me, they don't necessarily know if I don't tell them. They may presume I'm being vaccinated, but they don't know. But for me to say, I'm vaccinated, my husband's vaccinated, my children, the first opportunity, my children got vaccinated, because to your point, I think we talked about earlier, we wanted to be able to go visit our grandparents. We are very generational. We had Sunday dinner all the time. And when it didn't happen, it really was a pivotal moment for our I would say grandparents, my children's grandparents, and for my in-laws. That was a gathering time where we fellowshipped. So we recognized we could see emotional and behavioral and mental health sort of decline for us not even being there. And Zoom was not going to be the way it was going to happen. She was going to make dinner on Sunday, our mac and cheese and some, our two meets that we had and we, sat around and talked, it was not going to happen until we sort of all said, okay, get vaccinated. So that younger population, I think, is now taking the charge where we need to get them vaccinated so we can get them into school safely to support and protect their teachers. And that's going to be the next step.
Dr. White, I just want to raise up before we get to the question that's asked for Stacy, is that is so true, right? When we're talking about our Black and Brown communities, that fellowship is very important. And we've seen in 2020 in the early and now at parts of 2021, how important mental health has been. We've seen that. And so that is just an amazing raise up that you're talking about. So it's good that you lifted that up, that fellowship does directly correlate with Black mental health and Brown mental health and family ties and familiar relationships. So, because that's generally what our communities are based on anyway. So that's really awesome. Thank you for lifting that up. Stacy, we've got a question for you. It says, there have been many ongoing interventions for promoting the vaccine in Black and Brown communities. What are some other ideas or ongoing interventions for promoting vaccinations in Black and Brown communities, in your opinion?
That's a great question. So as Dr. White mentioned, we have a vaccine scholarship, and that scholarship serves as an incentive for people, particularly youth, to get out and be vaccinated. And we also offer other incentives, such as providing access to social resources, because we understand that people are not only concerned about COVID-19, they're also concerned about their day-to-day life circumstances, right? Whether or not they have a job, whether their kids are truly learning at school. And we also link individuals who participate in our vaccine events and our outreach initiatives with linkages to those social services. And so that's another incentive. So incentivizing the process is one other approach. We're also providing transportation. Transportation is a huge barrier to accessing vaccines, right? And so we make sure as much as possible and in collaboration with partners that individuals are able to be transported to our vaccination events. And so it's a multi-pronged approach. It's not just about the vaccinations. We understand that there's a larger context that we're operating under. And we try to address many of those issues. And those that we aren't able to directly influence, we work with partners like Good Reason Houston and leverage those partnerships to fully and more comprehensively address those contextual factors.
Awesome. Thank you, Stacey. A question came in for you, Brother Kyle Maroney, actually from a brother. So the question is, we have one of our national programs, My Brother's Keeper. How would I encourage, or would we encourage brothers from our chapter? They're not in our chapter, they're in another chapter, but how would I encourage our brothers from my chapter, he says, senior brothers to get vaccinated?
So specifically senior brothers in another chapter, right?
Mm-hmm.
I think, again, going back to the responsibility and to Dr. White's point, fraternities and sororities are built on brotherhood and sisterhood. So you can only get so much out of that via Zoom. So for us, the responsibility is to try our best to get vaccinated, to be able to get back to in-person fellowship. And again, going back to the leadership responsibility that fraternities and sororities have in our community, that is something.
I think we lost him for a second. I think he froze. But I want to pick up because I am my brother's keeper. So just piggybacking off of what I believe the point Kyle is making is that it is our responsibility as members in Alpha Phi Alpha, and not just Alpha Phi Alpha, but in our Divine Nine fraternities and sororities, to lead the charge and lead the way, because we all lead the way in service. We all lead the way in scholarship and fellowship. And it is our responsibility to lead that way in vaccinations and lead the way in conversations such as this. A question just came through on the chat for Good Reason Houston. So the question that was posed to me is, how do we encourage, or what will we say to teachers in our districts who may be anti-vaccination? Thank you for that question. That is a really good question. I definitely think, again, the advice that I would say is, again, when we're coming from the lens of making sure to close those academic gaps, making sure, because children don't just need their parents, they need their teachers too. They need their admins, they need their friends at school. Again, to speak to Dr. White's point, again, that fellowship in that Black and Brown community, and all communities actually, is extremely important. That mental health is extremely important. We know that a lot of kids go to school to release, to socialize. A lot of kids get their meals at school. A lot of kids get their love at school. A lot of kids get clothes at school, and they look forward to seeing those teachers every day. Some kids look forward to seeing their teachers when they look forward to seeing other people. So having teachers be vaccinated is really important, because our teachers, just like our fraternity and sorority leaders, are the frontline leaders at our school. Every teacher, I used to say this when I was a teacher, every teacher is the principal of their classroom. So if I'm the principal of my classroom and I'm the leader of my classroom, I want to lead by example. And me saying, just like what Dr. White said, my narrative, I am a teacher, I am vaccinated. I'm saying that. You may go home and encourage your parent, hey, mom, dad, get vaccinated. Or I, as the teacher in the teacher's lounge, may be encouraging the other teachers to get vaccinated. And once we are where we need to be, and that plays a part of that herd immunity, again, we are closing those academic gaps. We are seeing less failures on standardized tests. We are seeing less academic crises. We are seeing less SPED students and LEP students not getting their services. We are seeing less gifted and talented students not being able to be pushed to the next level. We are seeing less students not applying for college. We are seeing less academic deformities or deformations, or less just academic problems, period. And so that's what I would say to those teachers who are anti-vax, and just encourage them. Again, it's for the community, it's for ourselves. We have a lot of teachers who love to Sunday fun day, right? Teachers work Monday through Friday, and on Sunday, they're out there having a good time. And so when they're out there having a good time, if they are not protecting their immune systems when they go back to school on Monday, they're exposing other people. So that's what I would say. At this time, again, we'd like to take any last questions. I think we have had some really robust answers. I just want to shout out our panelists again, who have done some really, really amazing question and answer tackling. It feels like we were almost at the Mr. and Mrs. Prairie View pageant, because they had all these questions like on the spot that we just had to come up and answer. But if there are any other questions for those panelists, for those audience members who are watching, again, our audience is robust. I can see the count here. We are well over what we expected to be tonight. So we're excited about that. But if anyone else has any questions, drop them in the chat or in the questions, and we will get those answered for you. At this time, what we want to do is nearing the end of our evening. And before we give our last raffle, what we want to do is give each panelist the space and the opportunity to advertise and talk about and promote what is next, either in your organization, or what your organization is doing for the community, or any other upcoming events. I'm going to start with Dr. Narcisse, if his organization has anything as far as on the medical end, or even if he has anything for his chapter is doing anything that you're involved in, or the organizations you're affiliated with, Dr. Narcisse, anything's coming up on your end.
Two things I'd like to say. Again, I am my brother's keeper. The Brother's Keeper program came out of Alpha Eta Lambda, Brother Peter's efforts, and it sort of speaks to the very heart of what it means to be an alpha, to do things for other people. We speak on these terms, but this is an opportunity not just to get vaccinated for yourself, not just vaccinated for your family members, but for your community members, for those who can't get the vaccine because they're immunocompromised, because they haven't been able to get out of the house, because they don't have enough transportation. So you can do things with that. What I'd like to say is that in broad terms, think about participating in research. People say that we don't have enough. We have lots of questions about what research means in the African American community. Everybody brings up Tuskegee. Well, my mother was born in Tuskegee. My grandfather, my grandmother were there. They knew the people in the Tuskegee acceptance experiment. What they had wasn't the government did things to those people. They were not given the opportunity to receive the benefits of what could have been done. You can get vaccinated. You can do things for your community. You can be your brother's keeper.
Awesome. Thank you, Brother Dr. Narcisse. The next is for Stacy Lofton and or Dr. White. Either one of you are tag team, whatever you prefer. What is next on the agenda for Harris County Public Health? Any events coming up, any vaccination drives, anything that the public needs to know about, things you guys have coming down the pike?
Sure. So as part of our equitable vaccine strategies, we continuously provide culturally responsive vaccine services. And as part of that effort, we are hosting a number of Juneteenth related vaccine events. And I'm going to drop some of those events, the location for some of those events this week, June 19th and June 20th. Into the chat. And again, thanks to Pastor West and Church Without Walls, we're really excited about that event on June 20th. Harris County Public Health is partnering with Church Without Walls for that event. And then we're also partnering with the Acres Home, College of Barber Design, the Shape Center, J.D. Walker Community Center, and a few other churches this coming weekend as part of our Juneteenth initiatives.
Awesome, awesome. Brother Kyle Maroney with the Epsilon Tau Lambda chapter, are there any events that your chapter or our chapter has coming up that you'd like to inform the community about?
Yes, so sorry about that, guys. I think the thunderstorm is like right over my house. So I appreciate you guys being patient with me. As Stacy mentioned, we are working in conjunction with the Church Without Walls and Harris County Public Health to provide not only this town hall space for our community, for the community that we serve, but also we will be present at Church Without Walls on Sunday, providing volunteer services to support the vaccine dispensing unit at Church Without Walls. You can come and get vaccinated, no ID, no insurance is needed, from 9 to 3 p.m. on Sunday at the Queenston campus of Church Without Walls. That is what we have coming up. So thank you.
Awesome. And on behalf of Good Reason Houston, every day is an amazing day for us to provide services and resources and connections and have conversations to move the needle on equity and education. And one of the big things that we are working on is our blueprint for change work, which I am the lead of, as well as our good partners work. With our blueprint for change work, we are meeting with partners all around Houston, from Bread of Life to Latinos for Education, to Reading with the Rapper, and Legends Do Live, YMCA, and several others, as well as Prairie View A&M University and Aldine, plus a host of other organizations and leaders in our community to rally around what the idea looks like to connect communities and schools even greater. We're also working centered right now at Blackshear Elementary with our Good Partners program in 3rd Ward, where we are working directly on that campus with the principal, with the teachers, with the parents and community members as well, to pour and bring resources directly into that school to continue to move and close those educational gaps, as well as move what the community needs and what they're looking for. So that's what's next for us here at Good Reason Houston. And you can always find us at www.goodreasonhouston.org and see the work that we're doing and connect with any one of our team members. For those panelists who are here right now, if your organization has any websites, chats, or any other things that you like, go on ahead and drop those in the chat. We'd love for everyone who is watching from the community to be able to have access and grab those. We want to, before we get out of here, we want to respect everyone's time. We have one more gift card prize to give out to a community member who has been watching, someone who has been highly engaged with us all evening long, asked some really great questions as well. We want to give a gift to Jenny Tang. We want to shout out Jenny Tang, and congratulations to Jenny Tang, who is not only, like Jarek Brown, winning a $25 gift card on behalf of Good Reason Houston, but a swag pack from Harris County Public Health. Brother Maroney is going to go ahead and flash some of that swag, some amazing swag. What we need from Brother Brown as well as Jenny Tang, I'm going to go ahead and drop my email address as well as my telephone number, my office number in the chat. If you could either email or text me your mailing address as well as your preferred email, we will go on ahead and get your swag as well as your gift card emailed and mailed directly to you. So again, I'm going to put my contact information in the chat so you can go on ahead and send me your email address as well as your mailing address so we can email you a gift card, mail you some swag. Give me just 1 second. Let me do that. And we just thank you all so much for attending this evening. Thank you. A special shout out to Harris County Public Health, a special shout out to the Church Without Walls, and a special shout out to Brother Dr. Victor Narcisse, as well as the amazing folks at Methodist and all their connectors. And a special shout out to Good Reason Houston, as well as the Epsilon Tau Lambda chapter of Alpha Phi Alpha Fraternity Incorporated. Thank you to everyone who stuck in here with us this evening. For those of you who soaked up some amazing knowledge, your questions were answered and asked. The primary focus of this program this evening was to, one, debunk and address some of those myths in our Black and Brown communities, continue to provide more equitable access for our Black and Brown communities, as well as education, as well as to pour some finances and some prizes into our community. And I think, panelists, that we have done all of those things. So cheers to all of you. Thank you on behalf of all of the partners, as well as Good Reason Houston, for watching and attending this evening. Go on ahead and share this if you see it on our Facebooks or our Instagrams or any other social medias. Like it, comment, as well as direct a friend here so they can see this conversation as well. If there's nothing else, we thank you for just being here with us, and good night to all those watching, and good night to all of our panelists. Yeah, have a good one.
Thank you.
Thank you.